Thank you for joining us today for this Medicare webinar series and today's topic, Medicare Options with Medigap and Medicare Advantage Plans, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for its support of this webinar series. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation. You can use the raise hand function or the chat area to let us know when you have a question. And now it's my pleasure to introduce our presenter, Barbara Sigmund of the Pikes Peak Area Agency on Aging. Barbara, it's all yours.
Thank you, Jared. Hello and welcome, everyone. I'm going to share my screen with you, and we will get started. Here at the Pikes Peak Area Council of Governments, well, first of all, I guess I better make a couple of announcements. Number one, we will take questions when we get to a break. And like Jared said, if you want to stop me, you can, but I prefer that we wait until there's a break and then we'll get to all of the questions before the night is over. Secondly, I'm going to breeze through these screens pretty fast at first, just because you've probably heard this before if you've been on any of our webinars. And then we'll slow down. And if by all means, if you think I'm going too fast, you let me know. Mission here at the Pikes Peak Area Council of Government Area Agency on Aging is to help older Americans remain in their homes by taking away those barriers that stop them from independent living. We assist with the coordination and development and comprehensive system of services for older persons in El Paso, Park, and Teller County, and we provide leadership and advocacy for them. We are truly an advocacy for, we don't represent any companies. We are just for our citizens here in El Paso, Teller, and Park. Next slide. We are in a partnership with the Pikes Peak Area Council, the Pikes Peak Library District, and us here at the Pikes Peak Area on Aging. Pikes Peak Library District transforms people's lives by providing information to them. They have 15 facilities, an online resources, a mobile library, and they are in most neighborhoods. They're nationally recognized as a public library. Next slide. Roma and I both are with the State Health Insurance Assistance Program. We provide Medicare beneficiaries with free and unbiased and in-depth one-on-one counseling to assist them with all of the nooks and crannies in Medicare and the insurance that goes with it. We help them understand original Medicare, Medicare Advantage, Medicare prescription drugs, Medicare supplements, insurance plans for retirees, applying for programs to assist those on low or limited income. And we serve 9 counties: El Paso, Park, Teller, Custer, Chaffee, Fremont, Huerfano, and Los Animas. Next slide. Just a real quick review of what you went through last week. Medicare Part A is free for most people. It covers inpatient hospitalization, skilled facility nursing homes, medically necessary home health care, and hospice services. Some deductibles and co-insurance will apply. Part B, everyone pays for Part B. It covers all the outpatient services and has an annual deductible and co-insurance. These are considered your original Medicare benefits. Later on, we'll be talking about original Medicare benefits and A and B, and make sure that you understand that these are the parts of Medicare. Next slide. Medicare provides 2 primary options for coverage in insurance. One is a Medicare supplement, also known as a Medigap. The other is a Medicare Advantage plan, also known as Part C. Both of them are available to anyone on original Medicare. They're regulated by Medicare, and they have some limited enrollment periods, which we'll go through all of those enrollment periods in just a little bit. Next slide. We're going to start with Medigap. Medigap is supplement insurance, or Medigap, whatever you choose to call it. Next slide, please. It's sold by private insurance companies. have to follow federal and state laws. Those are set up to protect you. It must say that it's a Medicare supplement insurance, and you'll see that on your card as well. It covers the gaps in original Medicare. Remember, original Medicare is A and B. They have standardized policies, A through N, except for Massachusetts, Minnesota, and Wisconsin. If you're going to move to one of those states, I would suggest you get a hold of the SHIP there and let them give you complete information on those plans that they also sell. We don't sell those in Colorado. The cost can vary by plan, by company, and by where you live. They're standardized, so that means that the services that they offer are locked in. Sometimes they're called level of coverage. You may hear them either way. But nevertheless, if you buy a plan from any insurance company, and it's going to be the same with every insurance company. The company you can choose, but whoa. What happened, Jared? Did you move it?
I anticipated and went ahead, but I went back. Sorry about that.
All right. That's all right. Just confused me there a little bit. Okay. Very often we get questions about, what company do I choose? You're going to choose the company oftentimes by price. How much does it cost? Because remember, it's already locked in, A through N. They're going to be the same no matter who you buy them from. So start looking for price. Company, you can also do a little homework on your own. Look at the different websites that have the way that companies are rated, the stability. It might be that you have a preference for a company or not. You might not like a certain company. Where you live is also going to determine your price. So if you live in Denver, you might have a little bit higher price than in Colorado. So you want to make sure that you get the right pricing, either from an agent or a website, or the website or call them up for certain plans. Go through an agent, go through a broker, or talk to us. We can help you with that. Next slide, please. If you don't need a Medigap policy if you already have a Medicare Advantage plan or some other type of Medicare plan. In some states, they have what's called a Medicare savings account. We do not have that in Colorado. Once again, you would want to get that information if you're going to be moving. Other credible coverage, if you have TRICARE for life. You don't need a Medigap because it's going to cover the same things. If you have a retirement plan, you have para, you have federal retirement, you don't need a Medigap. With a Medigap, you can go to any doctor, any hospital, any provider that accepts original Medicare anywhere in the U.S. or territories. It's the most portable option if you're going to be traveling. Next slide. Who can buy a Medigap? Anybody can buy a Medigap, but you have to have both parts, A and B, of Medicare. It's best if you buy one when you're in your guaranteed issue period, or if you can pass medical underwriting. We also, in Colorado, have Medigaps for people under 65. So that the best time to purchase it as well is going to be in your guaranteed issue period. Because it's very likely, if you're disabled, you're not going to be able to pass the underwriting. It's going to be more expensive if you buy one and you're under the age of 65, just simply because Medicare was set up initially for over 65, and when they added the disability, they charge more for that. But you will have another option if you age into Medicare. So if you're on disability earlier, you get another chance to change to some other kind of plan at 65. Clean slate at 65. Next slide. You can buy a Medigap pretty much at any time, subject to underwriting. The best time, as I said before, is during your guaranteed issue. It's during the 6 months after your 65th birthday is the Medigap open enrollment period. It starts the first day of the month that you're 65 and are enrolled in Part B. Or if you're working and you stop working, it would be when you get your Part B. So you could be any age, but you have to select Part B. Once your 6-month Medigap issue it begins, you can't stop it, you can't change it. So you would have to stay with it unless you qualify for a special enrollment period. Next slide. Special enrollment periods. Involuntary loss of coverage. So if you decide to retire, you go in and you tell your boss that you're going to retire and they say, nope, you can leave today. So you've lost your coverage. If you lose that coverage, then you get a special enrollment to go into your choice, either a supplement or into an advantage plan. So if your employer coverage ends or your retirement coverage ends, and occasionally it includes COBRA, but that is going to be for the next webinar. Medicare Advantage, using a test drive and so on. We'll get into test drive in just a little bit, and we'll discuss that on the next slide. So, next slide. What is not covered by a Medigap? Long-term care is not covered. Vision or dental, hearing aids, private duty nursing, outpatient prescription drugs. Next slide. This is the standardized Medicare supplement plans. Let's just take a quick look at a couple of them. So if you look at Plan A, you can see that it only pays for the 20% of the Part B coinsurance. And Part B, you get the coinsurance and it pays for the Part A deductible, and so on through all of the plans. Next slide. The state of Colorado, the Department of Insurance, has created a supplement booklet for you, and you can look through that. And these what you're going to see in there are the prices are just a guesstimate. They are within probably $20 to $50 of what it's going to really be. But in order to get the pricing completely or accurately, you would need to either go with a broker, an agent, or talk to us and we can help you with that. These are just estimates, so you can look at the price and determine whether that's in your budget or not. Next slide. And here it is broken down, and you can see the plans once again, how much they cost. Looking just across the top there, that's your plan. That's the plan letters. And then it tells you what the pricing is for each of these companies. Next slide. Let's stop there for just a minute. Do you have any questions? No questions, Jared?
Barbara, I'm not seeing any questions in the chat. No one's unmuted or raised their hand. If I see any, I'll stop you, but I think you're good to continue.
Okay. So let's get into the second option that you have, and that is a Medicare Advantage plan. Next step, slide. People in Medicare Advantage plans are enrolled in a private insurance plan that has contracted directly with Medicare. They're going to provide you with the same benefits that you would have had with original benefit with Medicare. It's just going to take over the administrative part of your Medicare. You'll still have all the rights and privileges of Medicare, but this coverage is going to replace Medicare as your primary. You still have the same rights and protections, as I said. You still get all the same Medicare covered services. It's just how and when and where and how much the plans determine that. You might get some extra benefits with an Advantage plan, such as hearing or vision, dental, gym memberships. I would recommend that you read the plan very, very carefully, because when I say that it may get extra, you may get extra benefits. If you're looking for something in particular, you need to read the plan first and make sure that it's going to fit your needs. Dental care sometimes means a couple of cleanings to some plans. Other plans, it means you get lots of coverage. So check that out carefully. Plans usually provide prescription drug coverage. Next slide. You must live in the plan service area. Typically, that's the county that you live in. You must be enrolled in Medicare A and B. And you can only enroll during an eligibility period with some exceptions. And those exceptions are probably going to be your special enrollment periods. Next slide. Initial enrollment. So when you're first eligible for Medicare, the 3 months before, the month of, and 3 months after your birthday, during specific enrollment periods, that's during the annual election period, which is open enrollment, which is October the 15th through December the 7th. It's the same every year. The annual Medicare Advantage open enrollment is January through March 31st. That is, if you have an Advantage plan already and you decide that it really doesn't fit your needs and you want to try a different Advantage plan, you can do that. But you cannot do all of the other options that you can do during open enrollment. So this does not apply to Part D. It only applies Medicare Advantage plan to Medicare Advantage plan. Special enrollment period. If you have a special enrollment period, you could also use the special enrollment period. Next slide. There we go, October the 15th through December the 7th. You can choose your plan or get out of a plan, get into a different plan. Oh, I'm sorry. Yeah, this is annual. Thought for a second there I was on the wrong slide too. Medicare prescription drug plan, you can do that in open enrollment or annual election period. Original Medicare, you can drop back, or you can drop out of a supplement plan and go into an Advantage plan. Your new plans are always going to start January 1. Next slide. Medicare Advantage open enrollment, January 1st through March 31st, January 1st through March 31st. And the change will be effective the next month. If you're already in Advantage plan, you can change to a different one, which is what I already mentioned. If you're not in an Advantage plan, you cannot enroll in an Advantage plan. You cannot get a Part D, and you can't change out your Part D during this period. Next slide. Special enrollment periods. If you move out of the plan service area and you can't take it with you, or if your plan leaves Medicare, or if you have loss of credible coverage, we'll talk about that in just a second, or if you happen to be in a test drive for an Advantage plan or for the Medigap. Next slide. Your out-of-pocket cost, you must still pay the Part B premium, always, always, always. You may pay additional monthly premium, especially if you go with a PPO, and you will have to pay out-of-pocket costs. You're going to have copays and deductibles for the services. They have copays for every service. Some of your plans will not have a deductible for certain things, and other things they will. Next slide. How do MA plans actually work? Generally, all the Medicare the services are covered through the plan. They won't be covered through original Medicare anymore. Medicare will not help you. You will have to call the insurance company if you have a problem. They can include prescription drug coverage, but there are some that don't have drug coverage. You need to make sure you understand which one you're enrolling in if you enroll yourself. You'll have to go to certain doctors or certain hospitals to get care. If you need emergency service, you can get that anywhere in the United States. Benefits and cost sharing may be different from the original Medicare plan. Next slide. Medicare Advantage plans, you can get different ones. An HMO is a health maintenance organization. A PPO is a preferred provider organization. Medicare Private Fee for Service, PFFS. Medicare Special Needs Plans, these are usually for low-income folks. Or you can get a hybrid option, and that would be point of service. Those are a little bit more complicated. If you're interested in that, you probably should give us a call. Next slide. There's also Medicare savings accounts. We do not have those in Colorado. There are some pilot plans out there. We also do not have any going on in Colorado right now. And programs of all-inclusive care for the elderly, PACE. You've probably seen the advertisements on TV for Rocky Mountain PACE. Next slide. Co-payments are normally set by the plan. Generally, you must get care and serve all your services from the plan's network. Service area and network area is your county typically. The referral required for some doctors, and so you'll need to check with your plan and see if you need to get a referral. If you go outside of the care that you get, that they offer you in an HMO, you will pay all of the service, all the cost of the service. And covered if emergency or urgently needed care is always going to be done. Usually it includes Part D. The HMO plans are usually the most limited, and they have the smaller networks, don't allow you to go out of network. If you have something that is outside of the HMO, you need to talk with the plan before you go ahead and get that service done. Next slide. A Medicare PPO plan. You can see that a doctor or a provider that accepts the plan. You don't need to get a referral to go to a specialist. You don't need to get a referral for an out-of-network provider. You will pay copays, and those are set up by the plan. And if you go out of network, once again, I recommend that you read your policy because it usually will cost you more to go out of network. It may or may not include a prescription drug coverage. Once again, they do have those that do not have drug coverage. You will need to check that if you're going to enroll yourself. Make sure that you're enrolling yourself in one for drug coverage if you need drug coverage. And you can out enroll into Part D if PPO doesn't include prescription drug coverage. So in other words, you can't have a PPO that doesn't have coverage and then enroll in an extra Part D plan, because the Part D is going to cancel out the PPO. Be very careful with that one. Next slide. PFFS plans. With these plans, you can see any Medicare-approved doctor or hospital that accepts the plan. That's something you need to check before you go. You can get services outside of the service area. You don't have to ask for a referral for a specialist. The plan sets the copayment amounts. It may or may not include prescription drug coverage. You can roll in a Part D if the PFFS plan isn't included in the plan. And providers may accept PFFS on a case-to-case basis. So this is different than the PPO. In the PFFS plan, you can get an extra Part D. Next slide. Special needs plans, as I said before, they're typically for low income, those eligible for Medicare and Medicaid, those people in certain institutions, or if you have a qualifying health condition. And the plans are going to differ on that as well. They're not in all areas. If you want to get one of those plans, you might want to contact Medicare. Next slide. PACE is a program for all-inclusive care for the elderly. It works like an HMO. So you're going to use PACE providers. It provides case management. It's going to require you to stay in network for the services. You are going to have to get a referral. It primarily is for those on Medicare and Medicaid and long-term care. It's designed to help people stay in the community. They typically have transportation to your different services. Next slide. Rights in your MA plans. You have access to healthcare providers. You can find out how the doctors are paid. Fair, efficient, and timely appeals process. Fast appeals in certain healthcare settings. You can get healthcare services that you need. Receive easy to understand information and have your personal information kept private. Next slide. Medicare Advantage plans marketing. This is going to be typically done by agents, brokers, companies. They cannot approach beneficiaries in common areas. Well, before we get to this, why don't we see, Jared, do we have anything? Any questions?
No questions have come in, but if anyone online wants to raise their hand or unmute or put a question into the chat, they're more than welcome to at this time.
Okay, just thought I'd check.
Yep.
So let's get to the marketing do's and don'ts. And this is for the Medicare Advantage plans. They cannot approach you on the sidewalk or the common area, parking lot, lobby, whatever, and talk to you about signing up for a plan. They cannot send unsolicited text or unsolicited calls. They can send emails, but they must have the opt-out option available to you. They can solicit via print or media or conventional mail. And those of you that are getting ready to turn 65 know you get a box full every day. Cannot use the term free to describe a zero premium plan or reductions in deductibles or cost sharing. They cannot require attendants to provide contact information as a prerequisite for attending a marketing event. And they can't have a sign-in sheet. They can't camp out outside of the doctor's office. Next slide. They can't misrepresent themselves to the beneficiary. So oftentimes, not oftentimes, sometimes they might say they're with Medicare when in reality they are actually with an insurance company. They cannot conduct marketing at educational events. They can conduct a sales event immediately following an education event. They cannot provide meals at marketing or sales events. They can provide refreshments or light snacks. They cannot offer free services, items greater than $15 or $75 for a year. And they cannot solicit door-to-door. Next slide. Medicare Advantage plans must use marketing materials that have been submitted to CMS, reviewed, and approved. They must be by the guidelines. They have to comply with the Do Not Call registry. They have to obtain permission to contact you. They have to complete a scope of appointment. Next slide, please. Comparing Medicare health plans. Are your prescription drug coverage? If you have a particular illness and your particular drug, you need to make sure that Advantage plan covers that drug. You need to find out if you need to choose a primary care doctor or they're going to choose one for you. You need to find out if you can get health care from your doctor, any doctor that you use now, or hospital. Do you have to see the primary care doctor first to be referred to a specialist? And what else do you need to know about this type of plan? Next slide. Next slide. These are the plans that are available in El Paso County. We also have them for Park and Teller County. If you would like to have a spreadsheet that gives you the latest information that we have on the co-pays, then you can give us a call at our office. Next slide. Medicare Savings Program. Next slide.
Barbara, if we want to, before we dive into this, there's a person who has his hand raised.
Okay, let's hear it.
Good evening.
Good evening.
How do I get a list of the Medicare providers and the Medicare plans available in the county I live in? I don't live in El Paso, Teller, or Park.
Okay. Are you familiar with how to go on Medicare.gov?
Sure, that's easy enough.
Okay, you go on to Medicare.gov and you select where it says to choose a plan, and you put in your zip code, and it will ask you what is it that you want to look at, and you put in whether you want to look at the Advantage plan or do you want to look at the Part D plan, and it will list them there with what is provided in the plan. So if you don't live in those counties that we have available.
Okay, so can I also find Medicare providers, physicians on that site, medicare.gov?
Yes, should be.
Okay, I thank you.
But for safety, if it were me, I think I would call the doctor's office and talk to someone in the billing department and ask them. Remember that these guys are doctors. They're not necessarily web people or insurance people. So what you see online may or may not be up to date. It should be in Medicare. But just to be on the safe side, you can call the doctor's office.
Okay, I appreciate that. Thank you very much.
You're welcome. Sure. Next slide. So if you are low income and you need some help paying Medicare costs, QMB is with the lowest incomes. Those are 1,235 through 1,546. It's what we call QMB. SLMB, 1,478 to 1,992 for a couple. Up to 1,660 is a QI, and 2,239 for a couple. The assets, 10,590, 16,630 for a couple. And there is a burial allowance as well. They'll ask you on the application if you're going to need burial assistance, and then they will offer a certain amount for burial assistance. And they also at the same time will ask you if you have money that's available to you in a life insurance plan that has cash value. These incomes and assets change every April. So these are the ones for this year. Next April, we will have new information. Sometimes it comes out a little bit earlier than that, but not always. Next slide. Be alert for scammers. You all know, we've all heard, there's lots of them out there. Medicare covers the COVID-19 vaccine at no cost to you. If anyone asks you to pay your share or asks you about your Medicare number or how to get access to the vaccine, you can bet it's a scam. We have something called the SMP program, which is the Senior Medicare Patrol. It educates and empowers and protects you from the potential Medicare fraud that's out there. Errors happen, but fraud and abuse should not happen. If you have information or you want to get more information or you want to be a volunteer, the number is here for the CMS or SMP hotline. 800-503-5190, or you can visit the website. Next slide. This gives you information if you want to be a crime fighter in your community, you want to help to keep our Medicare costs down, you can apply with the Senior Medicare Patrol and put all of your skills to work. So if you would like to volunteer, all of the information is there for you. You can call them, you can call us, or you can go online and check it out. Next slide. Any questions, anything? We're going to finish up early here, folks. So if you have anything at all that you want to ask, now is the time. Still nothing? Yes, those are typically Medicare and Medicaid. Did you see that, Jared?
I did. I was about to
Okay.
flag you, but you got there before I
Saw
did.
it there. Yeah. Yes, those are typically for Medicare and Medicaid. If you're on Medicare and Medicaid and you lose your Medicaid for whatever reason, you got a job or whatever, then you would not be eligible anymore for the special needs plan, and you would need to contact the plan and let them put you in a plan that is right for you. Be prepared. That's they cover more things. So let them know so they can put you in the right plan. Be prepared that you're probably going to pay co-pays when you go on to a different kind. So, Karen, can you elaborate a little bit? You want to mute yourself?
Hi.
Hi.
Thank you. Yeah,
Sure.
I just I'm on currently on Medicaid now, and I called them to ask some questions, and the woman I spoke with referred me to you guys, but she
Okay.
also said that I wanted to get QMB, but she wouldn't tell me the, sort of, how much or how little I had to make. And, I don't want to sort of hijack the meeting with talking about Medicaid issues, because I don't know if these other people have Medicaid questions. So maybe I should talk to you later or do that, because I'm sure everyone else.
Okay. That's okay. I'll make it pretty quick. Yes, there are income limitations, and Jared, if you want to back up to that slide. Okay.
They have 1233 for QMB, and then what SLMB for 1478, and then QI.
Yeah. So there's basically 3 levels of Medicaid. The QMB, it will pay for your Part B premium and copays. The SLMB and the QI are only going to pay for your Part B premium. The asset level is 10,590. It's going to stay the same for all 3.
And is this what I've heard is called extra care, or is that?
No, extra help is through the Social Security Administration. Yeah, extra help is through Social Security, and normally you will get the extra help if you have any of these.
And last question, not about Medicaid. In terms of, if I'm understanding Medicare Advantage, what you're saying is that they're supposed to cover all the same things essentially that Medicare does, because that's, if they call them, so they're an Medicare. So, but it's confusing.
The same kinds of services, yes.
Okay. So the key difference is if you have health issues and stuff, you want to make sure that an Advantage plan, if I'm looking for an Advantage plan, I want to make sure that they cover the medications that I need versus, because that's the big thing is Medicare Advantage.
Absolutely.
And I'm a little confused because a lot of people, I don't know anybody that's on regular Medicare. Everyone said, oh my God, it's like, you don't want to do that. And I'm a little confused.
Oh, they don't want to do that? Regular Medicare?
I have a lot of health problems, and all the groups I'm with are like, people are like, no, 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 no. You have to, find an advance. My daughter's, on disability, and she's like, Mom, you can't do this. You're going to destroy it. So I'm kind of a little. That's why I'm doing this plan, because I'm a little bit freaked out and overwhelmed.
Okay, so if you you do need to check and make sure that the Advantage plan covers the medications that you're on, and also that the doctor's in the plan. So when they say you can't do Medicare, you don't really have a choice. If you're 65, you are going to have to go to Medicare and to a Medicare savings program. But depending on your income, you'll get help with that. But you might want to think about going with a supplement plan. They're portable. You could go to any doctor that accepts Medicare, because Medicare is your primary, and look for a Part D. If you go an awful lot to the doctor, that might be a good option for you.
Okay. Thank you very much. Apologies to everyone else about the
No problem, Karen. If you need to call me, please do. I'll be in my office tomorrow.
Great. Thank you
We
very
need
much.
to make an appointment, we will. Okay, anybody else? So here is our contact information. Roma's got her information down there. You can also call me again, Barbara Sigmund, at extension 147. I will be glad to help you on a one-to-one. The numbers here, they're the local number. We usually answer the phone 9 to 4. That doesn't mean we're not working the rest of the time, but 9 to 4 are definitely our hours for the SHIP program. Next slide. Is there another one?
That is the end.
Okay. If you don't have any other questions, please remember that we are available to you for one-on-ones. We can bring you into the office. We can get you on the phone. We can do it by Zoom. We can do it by Teams, however you choose. During work hours, after work hours, we're pretty flexible. Just give us a call and set that up. We'll be glad to help you. Okay, if there's nothing else, we will end it. Okay, Karen, you call me. I'll help you. You can breathe again.
All
Okay,
right.
Jared, I think that'll do it.
Well, thank you, Barbara, and I want to thank everyone for taking the time for joining us for this Medicare webinar series. We hope this information has been helpful for you. This is the second session of our 4-part series, and it will be available for on-demand viewing by tomorrow afternoon. Next week's topic will be Medicare Part D. You'll be receiving a survey after this webinar tonight, and we would greatly appreciate your feedback on your thoughts on this webinar and how it can be improved. Thank you, Barbara, once again. Thank you for all of our attendees for joining us tonight, and we hope you have a wonderful evening.